How soon after explant surgery can you have implants? So one must presume we're talking about breast implants, obviously. What other implants were we talking about? Well, I guess it kind of depends on why you're having the implants out. I mean, if you're having it out for infection or something like that, obviously you want to make sure the infection's all cleared. But if you're just having them out because you want them changed, personally, I will do a change of implants. I will take them out and put the next ones in at the same time. So unless there's a reason not to do it straight away, you know, because kind of if you're asking that question, you are kind of, this is a patient who's, well, maybe they've already had an explant, but you know, if you haven't had the explant, I'd be like, I would put them out and put them back in again at the same time. There might be a reason why you wouldn't do that, and infection's kind of like the obvious one. But let's just, so that's the first thing. I would often do it kind of immediately in the same operation. But if for whatever reason there's a reason not, if the pocket's not right or there's some issue or something like that, fair enough. I'll answer the question in that case. I'm going to say 4 months. It kind of depends a bit, you know. It depends on how things heal and everything. If it doesn't heal up properly, if as I say, there's infection around the area or something like that, then you might want to leave it a bit longer. But 4 months, I say, would be a good ballpark, and that would be kind of like the minimum, because you want that scarring to settle. You want the scar tissue underneath the skin all to soften and settle. From a surgical point of view, the longer you leave it, the better. So the longer you leave it, the more supple those tissues get, the more supple and soft that scar gets, the better. So really, from our point of view, we kind of want to leave it as long as possible. The surgery is a lot easier the longer you leave it. You know, if you go in too soon, the surgery is not very easy. I used to do things around 3 months. I'm thinking more about serial excisions and things now, but it's the same concept, you know, going back in to a surgical field. And it's just not, it's, you know, 4 months as a ballpark, I think, is a better ballpark. But it is a ballpark, you know. Might be longer, might be shorter if everything heals really well and it's lovely soft and you've got reasons to get it, you know, get on with it. You know, might be 3 months, but I'd say 4 months is a ballpark for me anyway.